the welcome to the special board meeting, August board meeting. And thank you, board members, for coming together in August. We typically don't have an August meeting, but this is a really important topic, as you know, and so we're having to hold this meeting. First, I'd like to start by welcoming Doug Jacobs, who is the new executive director at Maryland Healthcare Commission, and we're really thrilled to have him at MHCC, but also on our board because he brings a lot of experience and knowledge that will be very valuable to the Board of Trustees. So thank you and welcome. Secretary Seshamani is on vacation, as is Kat Rogers, and Maria Rodriguez could not make it today. So we do have a quorum with the rest of the board members, and thank you very much. And I will turn it over to Vice Chair Luke Aika to run the meeting. So thank you, Aika.
Thank you and welcome, Douglas. We're happy to have you in space with us. I'll start with calling the meeting to order. And our first order of business is the meeting minutes from last month. And so I move to approve the Board of Trustees minutes from the July 21st, 2025 meeting as presented.
I'll second.
There you go.
All in favor?
Aye.
Aye. Great.
Okay, I have everybody. Thank you.
Probably
Thanks,
might
Cynthia.
have, Doug, did you abstain?
I tried to say aye. Do we vote by raising our hands or do we say aye? I'm
Good
just getting
point.
used to it. Sorry.
No, we raise our hand until Cynthia acknowledges that you've been, I mean, you can say aye too, but sometimes, she'll do both.
I got
Okay.
everybody, but Doug, you
Okay.
are voting on this.
What? I'm sorry.
You are voting. You're not abstaining from this.
Oh yeah, I'll vote in favor.
Okay, thank you. I
approving
have
the minutes.
everybody then.
Thanks.
Perfect. Thank you. And then our next order, which will probably be the bulk of our time, is around the final 2026 state subsidy and reinsurance parameters. And so I know we got a bit of an introduction to that last month. Thank you, Joanna, for kind of setting us and gearing us up for this. And so I will turn it over to you in prep for the vote.
Excellent, thank you. And can you all see the presentation? The slides?
We can.
Yes. All right. So yes, I am looking forward to discussing our recommendation for the final 2026 state subsidy and reinsurance parameters with you all today and asking for a vote on those parameters. As you know, this has been the topic of a lot of modeling and discussion and thought between MHBE and MIA in consultation with MIA and work with our consulting actuaries. So as a little bit of a refresher in kind of recognition, even though I have gone over this with many of you, we do have board members who are pretty new to their role. So I'm gonna try to start out with just a refresher on reinsurance and what brings us here, and then move into updates since we last discussed this at the July board meeting and our recommendation. Oh, all right. Yes. So first off, reinsurance background. So as a story that is pretty well known at this point, when the ACA market reforms went into effect in 2014, that kicked off several years of significant rate increases in Maryland, like much of the country, as insurers' pricing caught up to the actual state of the individual market. And so Maryland experienced double-digit increases from 2014 through 2018, and simultaneously we saw a decline in enrollment as premiums were going up, particularly in our higher income unsubsidized portion of the market. The state took action in 2019 to create the reinsurance program, and you can see that kicked off 3 years of declines, which brought rates down by more than 30%, which was the intent of the reinsurance program, followed by years of modest increases in line with trend. But still rates remain more than 30% below where they would be if there were no reinsurance program. And in fact, more than 17% below where they were in 2018. Even with inflation since 2018, our rates are still lower than they were back then before the start of the reinsurance program. Of course, in 2026, we are looking at a change with proposed rate increases filed with the MIA of more than 17% on average due to the expiration, largely due to the expiration of the enhanced premium subsidies, which is what brings us all together to discuss the state subsidy program. So as I mentioned, this is a graph of enrollment over the years since 2016, and it's of the whole individual market with off-exchange enrollment in blue and on-exchange enrollment in orange. You can see that enrollment started, above 250,000 in 2016 and fell over the next couple years as premiums continued to climb. And then once reinsurance kicked off in 2019, we stemmed those losses, stabilized the market. Enrollment grew gradually up until around 2023, when the combination of the end of the Medicaid unwinding, or the start of the Medicaid unwinding, the end of the public health emergency, in combination with both our state young adult subsidy program and the broader federal enhanced APTC led to a supercharging of our enrollment as folks moved from Medicaid into individual market coverage that they could afford thanks to the premium support that was in place. So just a reminder of how reinsurance works. It reimburses insurers for a portion of their claims costs. Our state's reinsurance program is designed to reimburse reinsurers for about a third of their claims costs. Because their costs are lower, they consequently set their premiums lower. The board is charged by statute and regulation with setting the parameters for the reinsurance program, and the reinsurance program covers both on and off exchange individual market enrollees. So it's market wide, regardless of whether people are enrolling through Maryland Health Connection, on exchange, or directly with a carrier off exchange. Our reinsurance program operates under a federal 1332 waiver that's approved by the feds in 5-year increments. We're in our second waiver period, second 5-year period, which will end at the end of 2028. And that's why we will be talking and have been talking about getting from now to the end of 2028, because in 2029, we'll kick off our next 5-year period, assuming we choose to extend the waiver, and that's will bring with it new decisions that the state will have to make and the board. But for now, we know that this is in place until December 2028 and need to plan for how we get from here to there. The parameters for the reinsurance program that the board sets, there are 4 of them. And primarily we focus on the first 3 shown in this chart: the attachment point, coinsurance rate, and cap. So I know I'm repeating myself, but the attachment point is the point at which the reinsurance program starts paying claims for an individual. So when an individual accrues claims of about $20,000 in a year, the reinsurance program kicks in and pays 80% of claims up till that person hits $250,000 in claims. The attachment point is the main lever that we look at adjusting. It's been at $20,000 for most of the life of the program. It dipped down in 2023 when we were experiencing some higher rate increases. So the board chose to mitigate those with a temporary reduction in the attachment point. We brought it back up to $20,000 in 2024 and then increased it by $1,000 to $21,000 in 2025. All else being equal, we had planned for the attachment point to continue increasing by $1,000 per year from here on out to essentially keep up with inflation and keep the scope of the program at that rate of covering about a third of claims in the market. However, as you'll be hearing, we're proposing to diverge from that $1,000 a year increase that we had previously planned on due to, you know, the evolving circumstances of the individual market. Another thing I want to make sure is clear is that the attachment point does not, or the reinsurance program does not reimburse any individual person directly. It's calculated at an aggregate level by insurer, and that money flows directly to the insurer. So any individual person would not be aware of whether their claims had triggered a reinsurance payment to their carrier or not. It's all handled behind the scenes between MHBE and the carriers. And the assumption that carriers will get that reinsurance payment is what is factored into their rate development and leads to their rates being lower than they would absent the reinsurance program. The last factor here is the dampening factor. The board does not set the dampening factor. That is set by the insurance commissioner, but the board determines whether a dampening factor is necessary. And if they determine it is, then the insurance commissioner will set that factor. The dampening factor is a bit unique to Maryland, and it is meant to account for the intersection between risk adjustment, the federal risk adjustment program, and the reinsurance program. Both programs exist to compensate carriers for their high cost enrollees, and the risk with the overlap of these programs is that insurers could be overcompensated for their higher cost enrollees. And so the dampening factor works to adjust reinsurance payments to mitigate that circumstance. It doesn't actually reduce the overall amount of reinsurance that is paid into the market, but it adjusts the amount that is paid to each carrier to account for the intersection with risk adjustment payments. All right, and so this pair of pie charts provides a sense of the scope of the reinsurance program, both in terms of the enrollees that trigger reinsurance and the amount of claims covered by reinsurance. So you can see here in 2024, which is the most recent year for which we have data on reinsurance, that about 5% of enrollees, the blue slice on the left, met that threshold for payment, meaning they had claims that exceeded $20,000. Of that 5%, on the right, you can see the breakdown of claims. They accounted for about 2/3 of claims in the market. About half of that 2/3 of claims, or 1/3 in total, of claims in the market were covered by reinsurance. That's the dark blue wedge. And then about 1/3 of claims that were attributable to these high cost enrollees did not get reimbursed by the reinsurance program because they were under the 20,000 attachment point or over the 250K cap. And the other 95% of enrollees who didn't hit the 20,000 threshold for payment accounted for another approximately 1/3 of claims. So in total, the reinsurance program paid out about $640 million for 2024 out of nearly $2 billion in total claims in the market. Okay, so how do we pay all that money out? We do it through two sources of funding, one, state funds, and two, federal funds. So the state funds come from an assessment that is in place in state law currently through 2028. It sunsets at the end of 2028. It will have to be extended by the legislature if we continue the reinsurance program. But that assessment that's currently in place is 1% of health insurance premiums. It's collected by the MIA and transferred to MHBE to make reinsurance payments and to hold in our fund. In 2019, that 1% was actually 2.75%. So we had kind of a higher accrual of funds in 2019, and then that was more than the program actually cost back then to the state, or at least more in state funds than we needed. And so the legislature chose to reduce that for 2020 and future years to the 1%. So the state funds, we get that 1% assessment now in recent years. That's approximately $140 million a year. We also have a reserve that we've built up thanks to that higher assessment in 2019 and the fact that in the first few years of the program, we actually were able to fully finance the program using federal funds. So we banked the state funds we were collecting for several years, built up this reserve, which we have started drawing down to sustain the program. We also get federal funds for reinsurance. So under the waiver, we are under the 1332 waiver structure, states can waive certain provisions of the Affordable Care Act. And if doing so lowers premiums in the individual market, that reduces federal costs for federal premium subsidies. And then those savings to the feds are transferred from the feds to the state. So the feds don't actually end up saving money under the 1332 waiver. It's budget neutral for them. Their savings flow to the state to support their waiver program. And we refer to that federal funding that we get as pass-through funding. And that's the federal funding that supplies the bulk of what we use to support reinsurance. I will note here, this will come into play as we talk about the state subsidy, that to the extent a state intervention like a subsidy increases enrollees who are eligible for premium tax credits, it can also increase pass-through funding. So as you get more people in the market who qualify for federal subsidies, you also get more people who the feds are saving money on by virtue of having your intervention. And that increased pass-through funding can potentially reduce the state funds necessary to support the reinsurance program, which can partially offset the cost of that intervention you've created that increased APTC eligible enrollment. So this will come into play as we talk more about the cost of the subsidy program. The last item here is my beloved chart that we've had for several years now that shows lots of data about the reinsurance fund. In the green bar, you can see, or the green portion of the bar, the federal funds that have come in each year. The blue is the state funds. So you can see in the leftmost bar in 2019, we had that largest amount of blue state funds when we had the 2.75 assessment, and that blue state funding shrunk in future years when it went down to 1%. The red line shows the cost of the reinsurance program year to year. You can see in those first 3 years, the cost was below the green federal funding bar, as I mentioned. So federal funds covered the cost of the program in those early years, allowing us to put the state funds into our reserve for use, which kicked off in 2022. You can see we had to start. The red line slightly exceeded the funding that came in that year, and we started drawing down reserves. Not shown here are some other programs that the legislature tapped to fund with the reinsurance program, including a senior prescription drug affordability program, a one-time transfer to Medicaid of $50 million, health equity resource community grants, and the young adult subsidy. So that additional kind of program funding has been coming out of the reinsurance fund and contributes to why that purple fund balance is dipping down a bit over time. I'll pause there before I get into the state subsidy and just ask if there's any questions on reinsurance before I continue on.
Just one question. How much of the green bar growing reflects the higher PTCs from Congress? Do you know? I mean, it definitely captures some of that, right?
Yes, I don't think we have that specifically broken down, but I can say when we modeled out what would happen if EPTC were continued and extended, we projected, at least when we did this modeling exercise some months ago, that federal funds plus the 1% would be sufficient to cover the reinsurance program on an ongoing basis. So that loss of EPTC does bring down federal funding significantly, and that would be visible if this graph showed out years. We do have that modeling that shows what happens in 26 and beyond, and the green bar federal funding shrinks significantly.
Right. Thank you.
Can you say a little bit more about why the reinsurance cost has increased over the last several years?
It's really just increased both because our enrollment has grown a lot in the individual market in recent years. I'd say that's the combination of enrollment growth and then trend, just kind of standard medical trend.
Got it. Thank you.
And we have Brad, the chief actuary, on from the MIA. So Brad, please jump in at any point if you want to add to anything I'm saying. All right, so switching gears to the state subsidy background. So as Joanne was kind of guiding us to, the impact of the loss of enhanced tax credits on the market is going to be profound. This has knock-on effects to reinsurance, but immediate effects to enrollees and what they're paying out of pocket. So since 2021, when Congress increased the generosity of the premium tax credits, we have had higher levels of premium reduction in the individual market nationally. Those increased tax credits are set to expire at the end of 2025. They'll revert back to their less generous levels, kind of similar to what they were like in 2021, actually somewhat less generous than that due to some tweaks by Congress and the current administration. But essentially, you know, we're going back to this pre-pandemic level of tax credits. That's going to increase out-of-pocket premium costs for the total 190,000 Maryland healthcare enrollees who currently get tax credits. On average, their premiums will increase by 68%. That's what they're paying after receipt of tax credits. So because those tax credits are getting less generous, their monthly out-of-pocket costs are going up for their premiums significantly. Even the approximately 100,000 unsubsidized enrollees, who are the enrollees either off exchange, who are ineligible for tax credits if they don't enroll through Maryland Health Connection, or on exchange who earn too much to be eligible for tax credits, are likely to experience a significant rate increase. Insurers, as I previously mentioned, requested about 17% average rate increase. So that would be felt in full by these unsubsidized enrollees. And that is due to the fact that we anticipate a significant number of individuals will drop coverage next year due to these premium increases. Those are likely to be the healthier individuals, leaving the risk pool that remains in the individual market less healthy and a higher cost on average. So this is the enrollment graph that I showed previously, and has those kind of events that I mentioned, where you can see we implemented reinsurance, started seeing a gradual increase in our enrollment. Then both state and federal premium supports were implemented between 21 and 2022. And then once Medicaid unwinding started, we really saw our enrollment shoot up as folks kind of came unstuck and moved into the individual market. So House Bill 1082, which was passed this most recent legislative session, requires the exchange to create a state subsidy program to mitigate the anticipated enrollment losses and stabilize the market in 2026 and 2027. If Congress acts to extend the subsidies, then we don't move forward with implementing the program. So we are, as I've mentioned before, we'll continue monitoring what happens at the federal level. And if there are late breaking developments where the feds do continue the subsidies, we will have to quickly pivot and adjust our subsidy program. All three of our state's affordability programs, reinsurance, the young adult subsidy, which has operated from 2022 through 2025, and the full all ages subsidy that we're proposing for 26 and 27, use the same funding source, which is that 1% state assessment. In addition, we use the federal pass-through funds on reinsurance, but we can't use those federal funds on our state subsidy program. Those can only be funded out of state dollars. And because the value of the enhanced tax credits is so significant, we are not able really to budget to fully cover those. So we've, as you know, modeled many options for how we could mitigate the impact of their loss through a partial replacement at the state level. Let's see, yes. And as we've discussed previously, there are several categories of lawfully present immigrants who will be losing eligibility for APTC. If the first group is January 1, 2026, the next group is January 1, 2027. In our previous presentations, we had not incorporated this impact into our modeling because it was kind of finalized very close to the point at which we had the July board meeting. But since we had a little bit more time since then, we've been able to incorporate this loss of tax credit for the population who are losing them January 1, 2026 into the modeling. That's going to impact between 19 and 20,000 enrollees who are currently in this group receiving tax credits and who will lose eligibility. This group is lawfully present immigrants who are under 100% of the federal poverty level and ineligible for Medicaid because they're required to wait 5 years before they can receive Medicaid. So during that waiting period, they can enroll through the exchange and private plans and qualify for APTC. Then once they hit their 5 years, they can move into Medicaid. So this group, unfortunately, we were not able to figure out a way that we could afford to replace their loss of APTC. To do so just for this group would be about $154 million, which is really cost prohibitive. So as a result, we're proposing to limit the state subsidy to only those individuals who continue to be eligible also for APTC going forward. So that means that these immigrants losing APTC eligibility would not be eligible for the state subsidy either. All right, so moving into the state subsidy itself, as again, I've shared before, the legislation sets out 4 priorities for the subsidy design that the board work to mitigate reduction in federal tax credits, maximize enrollment in the individual market, balance the state subsidy with the reinsurance program from a funding perspective, and to the best of your abilities, take into account the uncertainties looming across our different coverage groups in the state, including Medicaid, the individual market, and the small group market. Couple of just reference points here that I've shared before. This is how the federal poverty level translates to actual income for a single person household and a household of 4 at different FPL levels, because we talk a lot about FPL in this conversation. And then a snapshot of who the impacted enrollees are in Maryland Health Connection. These are the 190,000 folks I mentioned who are currently receiving tax credits and how they break down across age and FPL buckets. So as we were evaluating our different options, as you know, for the state subsidies, we looked at 3 high-level buckets of considerations, how the state subsidy would impact the market overall from the standpoint of how it would impact folks' net premiums, meaning what they actually pay out of pocket for their monthly premium after receipt of federal tax credits and the state subsidy, how that would impact enrollment, of course, going back to the law's priority of maximizing enrollment in the individual market, and the impact on silver loading, which I've discussed previously and won't get into the weedy details of unless anyone wants to dive into that more today. Of course, we also looked at the subsidy program cost, how much it would cost the state to pay out for subsidies, and what the impact would be on the reinsurance program and the state reinsurance fund, which is funding the subsidy and reinsurance. We looked, across 3 dimensions: the impact on reinsurance cost, because as we operate the state subsidy, we keep more people in the market. That likely increases how much we're paying out in reinsurance each year. But it also impacts our pass-through, as I mentioned, as we keep more people in the market who are eligible for premium tax credits, that can also increase the federal funds we receive. And then after we take all this into account, where does that leave our fund balance at the end of 2028, which is what we're focused on at the moment. So as you guys, again, know, we modeled lots of scenarios. We put them out for stakeholder comment. We discussed them with the insurers and other stakeholders who were interested in talking to us about them. We narrowed down to 2 leading contenders, which are labeled here and highlighted as A1 and A3, and these are what we presented to the board in July. And since then, we've further narrowed down our recommendation to basically the subsidy design presented to the board as A1, but with a slightly higher attachment point for the reinsurance program. And I'll get into this in more detail in the next few slides. So I do want to recap a few updates to our modeling since the July board meeting and the numbers that we shared at that point. We've updated the actuarial modeling to reflect a couple of federal developments. One, the IRS released the final expected contribution tables for 2026. That essentially sets how much premium tax credit folks are eligible for at each FPL level. And we had previously been estimating what that table would look like because we didn't have the final numbers from the IRS. It turns out that the final table released by the IRS was a bit less favorable than we had expected, meaning people will qualify for less premium tax credits than we had thought. That leaves the state subsidy to make up more of the difference between what the federal tax credit levels were this year and the higher than we had projected level that they'll be at next year. All that taken into account, all else being equal, has a negative $45 million impact on the state reinsurance fund balance by the end of 2028, meaning our costs to operate the state subsidy went up over that 3-year period. In addition, as I mentioned, we were able to remove the lawfully present immigrants who will no longer be eligible for APTC from our modeling. We had previously been including them because of the late breaking kind of finalization of that prior to the last meeting. Removing those individuals actually has a negative impact also on the fund balance because they qualify for a lot of federal pass-through funding, but they use less than average reinsurance. They're healthier than average. So essentially, they are a net positive for the reinsurance program if they're in the market. Removing them has the result of reducing our fund balance by $50 million by the end of 2028. So total kind of negative $95 million hit to our projections by the end of 28 from these two changes. You'll hear me talking about kind of where the fund balance is at the end of 28. We are also in our projections for out years, assuming that the exchange would be granted the authority to continue a state subsidy program through the end of 28. Currently, that authority only exists for 26 and 27, but for the purposes of giving you that kind of out year projection modeling, we felt it, upon further thought, most appropriate to model that the subsidy program would be in place for 28 because we think it more likely than not that the legislature would continue the board's authority to operate that program rather than letting, the enrollment impacts hit in 28 if the federal tax credits, are not extended over this period. So in the modeling, you'll see we assume that that subsidy program stays in place in 28 as well. And that allows us to demonstrate how could the board budget between the subsidy program and reinsurance over those 3 years. The other thing we assumed, and again, I'll mention this more going forward, is an increase in the attachment point from the originally anticipated $22,000 for next year. So I mentioned it's $21,000 this year. We had initially anticipated it would increase by $1,000 per year, which would put it at $22,000 next year. Instead, we're proposing that the board set that at $24,000 for next year, which will help us conserve a bit of funding. It has a positive 10 million impact on our fund balance by the end of 28. And it also softens future increases in the attachment point, so they're not as steep in 27 and 28 if the board decides that we need to continue kind of an accelerated increase in the attachment points to balance out all of the funding requirements. So I think this slide generally captures what I have previously mentioned, so I'll skip over it. But again, we've narrowed down from the many iterations we've done to essentially the A1 subsidy with an adjustment to the attachment point. So here in this chart, to walk you through it, if we look at the columns first, you'll see we have 2026, then 27, then 28. And we've got in 2026 mapped out the components of what we are recommending to the board. So an attachment point of $24,000 for the reinsurance program, a continuation of the young adult subsidy on the same terms as it's operating in this year into 2026. Fully replacing the value of the enhanced premium tax credits for our enrollees at or below 200% FPL, phasing down from that full replacement to a half replacement from 200 to 250% FPL, and then from 250 to 400% FPL, replacing half the value of the enhanced tax credits going away. And then no state subsidy on offer for the over 400% FPL. As you'll remember, we had been weighing the merits of should we offer a state subsidy or not to those over 400%. In order to afford to be able to do that, we'd have to increase the attachment point by a significant amount. What we had been modeling was about $30,000 to offset the cost of providing that subsidy to the higher income group. As we delved more into the interaction between increasing the attachment point versus offering that subsidy, we realized that increasing the attachment point really has, to some extent they cancel each other out, but increasing the attachment point on balance is kind of more costly to that higher income group than is offset by giving them the subsidy. So the balance that we felt was more appropriate to strike was to not extend the state subsidy to the over 400, but also restrain the increase in the attachment point. So that's what we are recommending for 2026. And at this meeting this year, the board is only setting the subsidy and reinsurance parameters for 2026. So the 27 and 28 parameters that we're showing here are just to give the board a sense of what it might choose to do in 27 and 28 and how that would play out from where we would land at the end of 2028 in the state fund balance. So we modeled a couple of scenarios, and I'm not saying that either of these are what staff would recommend to the board for 27 and 28, but just want to give you a sense of what the future could potentially look like and how, you know, we get through these years within the funding available. So across the kind of top scenario for 27 and 28, we've labeled scenario B2. The bottom scenario is scenario B3. They're similar in a number of regards. We've got an increase in the attachment point to $30,000 and then $36,000 in both scenarios. We have discontinued the young adult subsidy in both scenarios in 27 and 28. Again, not to say that this is what we would recommend for 27 and 28, but it's just sort of a fairly easy variable to toggle on and off to achieve some savings to kind of make the math work out. But there may be other ways that we could do that in future years. This is, again, just an option that we are, again, not necessarily recommending, but just displaying. So in both scenarios, again, we also are modeling that we would continue to fully replace the premium tax credits for the under 200% FPL for a number of reasons. They're the most efficient to replace tax credits for because they're still largely funded by federal funds. So state dollars go further when we are kind of stretching them out to cover the greatest number of people possible. They're also the most price sensitive. So each dollar we can spend on them is more likely to help keep someone in the market. And then there are also benefits to silver loading, which benefit the whole market from a premium tax credit kind of level. So, and then again, in both scenarios, we are modeled that we would not offer a state subsidy to the over 400% FPL group. So what's different across the two scenarios is what we do for that 200 to 400% FPL group, I mean to say. In scenario B2, we're modeling that we would do the same we would offer the same subsidy to them in 26 as we did in 2025, and then we would offer them no state subsidy in 2028. And I think I misspoke. I meant to say we would offer them the same subsidy in 27 as we did in 26, no state subsidy in 28. In scenario B3, rather than that kind of more generous 2027, but then a cliff in 2028, we'd modeled that we would reduce their state subsidy by half and offer it in both 27 and 28. So just a couple examples of what the future might look like. And essentially in those B2 and B3 scenarios, we were trying to come up with pathways that leave the fund balance at a positive level at the end of 2028. So those are options that would kind of work within the funding we expect to have over the next 3 years. And you can see for B2, the fund balance at the end of 28 is 19 million. For B3, it's 34 million. So, you know, you kind of like squeak through with a positive fund balance. For 2026, in the scenario we are recommending, you can see that in the enrollment decline relative to 2025 column, which is in the middle of the chart, we are anticipating that we would experience a 15% enrollment decline relative to current year enrollment if the board adopts the parameters we're recommending. About half of that is due to the 20,000 individuals losing eligibility for APTC, the legally present immigrants, and we presume losing coverage due to it being unaffordable. So if those individuals had continued to be eligible for APTC if the federal government had not made them ineligible, we would expect them to stay in the market and the enrollment decline would be more like 7%. Attributable to the change from the level of subsidization this year to the reduction next year. In the dark gray bar along the top, you can see our baseline scenario where we're modeling what would happen if the enhanced tax credits expired and there were no state subsidy. And in that scenario, we'd be looking at a loss of about 1/3 of the market. So although, of course, you know, I wish we could do more and preserve more of the market. What we are recommending is a meaningful reduction in that enrollment decline. So we're cutting that decline about in half. And then in those out years, that decline relative to 2025 increases over the years as we would be phasing out the state subsidy and increasing the attachment point. But even so, we're projecting that in 2028, under the example scenarios we had modeled, we would still be facing enrollment declines of 23 to 27% under our subsidy scenario, relative to a 39% decline if the state did nothing. So even as we are, pulling back on market support, we're still meaningfully preserving enrollments relative to if the state were to do nothing. So that kind of brings us to the recommendation, which I've described. And the last thing I'll mention before just pausing for questions is we also considered, should we go this route of making the state subsidy the most generous in 2026, knowing that we would not be able to afford this level of generosity in 27 and 28? Would it be more prudent to be less generous in 26 and save some funding for 27 and 28? And after discussion internally and with the MIA and with our consulting actuaries, we thought that this really is the most prudent course. Even if Congress does not act to extend the subsidies by the end of the year, there's still some hope that they might take action next year once the full impact of their loss is felt nationally. And so, we want to hold on to as much enrollment as we can in 2026 in the hopes that there might be a change in the federal approach to the tax credits. Because once you lose enrollees, traditionally it's pretty hard to get them back into the market. So we're kind of holding out as much as we can for 2026, and then we'll start ramping down in 27. We anticipate the board would start ramping down in 27 and 28 if necessary. So I will pause for questions, and I have more data as we go on. I have the heat maps that I had shared previously, which I can get into, which show the premium increase for an individual by each age and FPL bracket in our baseline scenario where we do nothing, relative to what we are projecting under the subsidy scenario we're recommending. So you can see in these heat maps for those under 200% FPL folks, they'll experience no increase because we're fully replacing their federal subsidy. And then while those above 200 will still experience, increases, it is meaningfully mitigated relative to what it would be if we had no state subsidy program. Okay, with that, I will really stop, and I'm happy to take questions.
Thank you, Joanna. This was a really good, just even more depth from July. I'm happy to just open it up to others before chiming in with questions. Curious other board members' thoughts as well.
I'll chime in here. Kudos to Johanna and the team. It's hard to look at this and it's just a collection of worst case scenarios, but you've done a remarkable job. My question is, in looking at this from the broader spectrum of across the nation, have there been other states that have been included in some of the modeling that you've done?
Could you expand a little bit on that question, Ken?
I know in previous years, we looked at best practices in other states when we were trying to make adjustments. Was any of that valuable or relevant to what you ended up with for your final recommendation?
I see. So we did through past work that we've done with the MIA exploring how other states subsidize their market. We and our kind of MIA counterparts were familiar with how other states constructed their subsidies, and that really fed into how we designed the young adult subsidy initially. And I kind of think of this as building on the young adult subsidy and the architecture of that for all ages. So I think it was folded in that way. But as far as I'm not aware of other states that are designing that have the funding to develop a subsidy for 2026 specifically to mitigate the loss of tax credits. I think Maryland is fairly unique in that.
Okay, thank you.
Just wanted to chime in and say, yeah, kudos, Johanna, to you and your team for all of this work. And of course, the MIA team, our actuarial team, has been working really closely, and just wanted to applaud them as well. I think in conversations, none of this feels amazing, right? To look at a projected loss of enrollment, but we are in such a better position to help protect Marylanders and costs versus other states. And I think this is just a really great option to help protect the cost of coverage with the resources we have. We cannot fully replace what the feds are projected to take away, but we have been very thoughtful, I think, in coming up with a design that works best for Maryland. So those are just some thoughts I have about this proposal. I'm very supportive.
Thank you so much. Douglas, I know you tried to unmute a few times, so I want to just get you some airtime here.
Thank you. Want to also remark, I think this analysis is tremendous, and it's a lot of incredible work that's been done. One question I had, not for 2026, but for 2027 and 2028, the B2 and 3 scenarios, I think, for the young adult subsidy, I wonder a little bit about the impact that might have on like disadvantaged communities who might otherwise become uninsured if that subsidy doesn't exist. And if it's worth like maybe thinking about a more nuanced approach to that. And the other group that I wonder about in that category is pregnant women in particular, and whether or not that they would, it feels particularly bad to have some of those folks become uninsured. But anyways, I just maybe pose a question as to whether or not it would be worth thinking about a nuanced approach there.
Yes, I think that's a great question, and absolutely. Before we come back to the board with an actual recommendation for 2027, we will be incorporating, our updated data that we've gathered in 2026 in the first, 4 months or so of data that we'll have at that point to update our projections. And I think we'll do the same thing we did this time. We're going to be going through a lot of iterations to try to figure out what the best option is to recommend to the board that has the least impact on our enrollment. And that may well entail not discontinuing the young adult subsidy. Like I said, it was really just sort of an easy thing to toggle off to get some savings as we were trying to map out how might we get to a positive fund balance at the end of 28, but that does not mean that's what we would actually recommend to the board in 27.
That makes a lot of sense. Thank you guys so much. And this is also, and just to reiterate, this is incredible. And I really appreciate like what we can do for Marylanders here compared to other states too. So thanks again.
Yeah, I just wanted to chime in quickly. I can't believe how clearly you presented the options and thoroughly considered the trade-offs. I mean, there's, you make one move and premiums go up or state funds go down. It's very, very complicated. And it seems like you really did your best to thread that needle and maximize the benefit for the most number of people. And I really appreciate the work of the exchange and the administration, Marie, for supporting that data. I guess, yeah, to Doug's question, it would be great to come back to the young adult subsidy with more data about what their other coverage options are, whether it's dependent coverage at 26 or Medicaid for pregnant people or whatever it is, just a fuller picture of who actually will be affected. And I guess I'd like to hear at some point what this means for like the follow-on effects, or the sort of operationally what the exchange has to do to allow for that adding on the state subsidy, if MIA is going to ask or allow issuers to refile to take, because I guess they filed assuming no enhanced premium tax credit, but now there's some, we're filling in big chunks here, although not the whole thing, and just how we're going to then approach the follow-on considerations and operational pieces.
Johanna, do you want me to start on the rate side?
Right, the rate. Yep.
You can talk about the harder stuff. I think on the rate side, our issuers have been getting comfortable with ambiguity and flexibility this summer. I think there's just been so much, even not just the subsidy, but like changes in the marketplace that impact their dynamics. So I know that we've asked them a number of questions through objections. We asked them to take some original thoughts on the initial subsidy designs we have, and we anticipate asking them with a pretty quick turn to give us updated projections based on this subsidy. Because we aren't an FFM state, because we are a state-based marketplace, I think our timeline for rate approval is a little bit different. So we have flexibility, and we don't anticipate going any later than mid-September to finalize rates.
And from the exchange operational standpoint, again, fortunate to be a state-based marketplace with an exceptionally nimble IT department who will be working to implement this in our system by the end of this month, once the board makes its vote, so that it can be in place in September when we run our renewals. So folks getting renewal notices for 2026 will see the state subsidy that they're eligible for reflected in that. And when folks come on to Maryland Health Connection in October, when we publish our plans for 26, they'll see an interface that includes their subsidy eligibility.
And Aika, if I might just add a comment or two, we are so fortunate in Maryland that we have the legislature that we have that really helped us in the beginning of this year to realize that this bill, to put it in and get it over the finish line so that we could do this. And the fact that we started off in that slide Johanna showed where we had that 2.75% assessment the first year, that allowed us to have a nice little cushion, and we've gotten additional pass-through funding from the federal government. So we have been in a better place to be able to do this. There's only 2 other states that I know of right now that are doing anything. I think Colorado is called a special session for their legislature so that they can come in and talk about how they can fund this. And I think California has put a lot of money into some state subsidy. And I don't know, Johanna, if there's anyone else you've heard of, but we're in a really unique role that we have the funding and we acted upon it and got this through, and have, as you've seen here, just tremendous staff at both at MHBE and at MAA that not only can figure this out and put it in easy terms for us, but then can implement it on a dime too to make this happen. So we're really fortunate in Maryland.
Thank you, Michelle. And my question was centered around pregnant women as well. And so Douglas beat me to it, which is great. And so thank you, Joanna, as it's helpful to kind of get a sense that a lot more modeling, and as we progress, we'll have a better sense of what onwards could look like as it relates to the adult subsidy, and just in prep for what we could do 2027, 28 and beyond. Anybody else have any other questions? All right. I motion to approve the final parameters for the state subsidy program for FY 2026 as presented. Do I have a second?
Second.
Sorry, let me just say it's for plan year 2026, not fiscal year 2026.
Oh, thank you for the purposes of our notes so I'll read it one more time. I move to approve the final parameters for the state subsidy program for plan year 2026 as presented. Now, do I have a second? Thank you, Joanna.
I'll second.
All in favor? Aye.
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 Okay, thank you. Have everyone.
Perfect. Thank you. And thank you, Joanna.
Thank you. And now we'll move on to the reinsurance parameters portion, which I think will be much quicker than the subsidy. All right, so in conjunction with setting the subsidy parameters, as we've went through, the board also has to set the reinsurance payment parameters for 2026. Already covered what those 4 parameters traditionally are. And here's a quick timeline for kind of key dates and processes for the reinsurance program. In February of every year, for our newer board members who may be unaware, the board sets estimated reinsurance parameters for the next year. Those are to give the insurers a sense of what the board may finalize so that when they file their rates with the MIA in the spring, they have something to base their assumptions on for what reinsurance parameters will be. But over the spring, we get data from the federal government on what our actual reinsurance payments are for the prior year, and we update our modeling and projections for the coming year. So we then bring those parameters to the board, usually in July, for the board to vote and approve and finalize for the coming year. And so they're in place when the MIA and insurers finalize rates in the August-September timeframe. Because we weren't yet ready to ask the board to finalize the subsidy parameters, and those are interwoven with the reinsurance parameters in July, we're a little bit late this year in asking the board to finalize the reinsurance parameters, but still ahead of when rates are due, still in time for carriers to incorporate them in their rates for 2026. So this again, is kind of ground that I've already covered. As I mentioned in February, when the board set the estimated parameters for 2026, they chose an attachment point per staff recommendation of 22,000, but as we've covered, given development since, we are instead recommending that $24,000 attachment point, which in conversations with the MIA, we think balances kind of fiscal prudence in saving a bit of money for kind of the state with its impact to the unsubsidized people and not having too heavy an impact on the market overall. So again, these are the this table I had shared previously. It's again showing on the right those highlighted figures how the reinsurance fund balance we project would look in the scenarios we had modeled in the out years. And we received one public comment. After the board sets the estimated parameters, we always request public comment on those prior to finalizing them. We received one comment from Kaiser, who supported an annual increase of somewhere in the range of $2,000 to $5,000. Essentially, they were saying they thought we should increase the attachment point a little bit more than the $1,000 the board had initially planned, and use some of the saved money on a state subsidy or other affordability program, which, as it so happens, is essentially what we are recommending. They also suggested that the state implement a quality performance program that would tie some reinsurance funding to ensure performance on HEDIS quality measures. That is beyond the board's statutory authority at the moment. The board only has authority to set the 4 parameters that I've outlined, but it's something that could be considered in the future if that authority were to change. That's it for me on reinsurance.
Can I just ask quickly, can you say a little bit more about the dampening factor and how that's established? And just so I understand the intent, but when I see 0.85 or whatever I think it was, does that mean an insurer would get 85% of under the reinsurance program that they would get because they have a bigger risk adjustment payment? Or what does that actually mean, and how's that number arrived at?
Well, I am gonna turn that question over to Brad, who I see is on. Hopefully, Brad, you can take that one.
Yeah, I can try to take that one. So the 0.85 is actually applied to the risk adjustment payment for each carrier. And that's what the dampening is. We're shrinking the risk adjustment magnitude for everybody. And so because risk adjustment is a $0 sum, the total amount dampened is equal across the market. But then we take that amount for each carrier, and apply it to the reinsurance payment, because reinsurance is the program we control. We can't tell the feds to alter the risk adjustment payments, but conceptually, if we could tell the feds to alter the risk adjustment payments, that's what we would be doing. We're shrinking the size of risk adjustment because reinsurance is taking that risk out of the market, and the needed transfers are smaller, if that makes sense.
Okay, thank you. And so does that change year to year based on the actuary's analysis? It does, right?
Yes. So there's an
Historic
actual
race.
analysis that tries to measure the overlap by looking at cohorts by their health status. And so the same methodology is done every year, but depending on the specifics of the risk adjustment actual results and the reinsurance results, the dampening factor has changed over time.
Okay, thanks. That's helpful. Sorry, Johanna, I know that wasn't actually anything you were asking us about, but since you brought it up, I had some questions about it.
No problem.
I had one more question too. Sorry, I'm just kind of like learning about all this as well. On the assessment that funds the reinsurance program, it started at 2.75, then it went to 1%. Per Michelle's point about the legislature kind of taking an active interest here, is there, if the legislature were to decide to increase the assessment from 1% to a higher amount, is that allowed within our 1332 waiver, or would we then have to go back to CMS to get it reapproved?
I don't think that would affect the CMS approval. I think the state could set that assessment at whatever it wanted. All that's relevant from CMS's standpoint is that we can meet our obligation under the program we've proposed, that we have enough money to fund the scope of the program. And we do anticipate that in 2027, the legislature will have to take up the issue of what that assessment should be going forward, because as I mentioned, it'll sunset at the end of 2028. In order to apply to CMS to extend the waiver past 2028, kind of timeline wise, we really need that question resolved in 27 to tee us up to submit the waiver application. And so we'll be modeling that, and the state legislature will need to kind of figure that out hopefully in 2027.
That makes a lot of sense, and it also makes sense why we'd be more generous in 2026 for that reason too, perhaps. Okay, thank you.
Any other questions? Great. I move to approve the following parameters to be the final plan year 2026 parameters for the state reinsurance program as presented. an attachment point of 24,000, a co-insurance rate of 80%, a reinsurance cap of 250,000, and a dampening factor to be determined by the insurance commissioner. Do I have a second?
Second.
All in favor? Aye.
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 Okay, thank you.
Thank you. And Joanna, I think that covers all of the items you needed to vote from us as well as the agenda, correct? I see a head nod.
Yes, it does. Yes, thank you.
That's great. And Michelle, anything else on your end you'd like to add?
No, other than thank you all. We know this was very meaty, and Johanna, as usual, you do a phenomenal job of making it easy to understand. So thank you all. We really appreciate your time today in August, and we'll see you again in September.
Perfect. Thank you, Michelle. Thank you, Joanna. Truly.
Thank you all.
Thank you.
Thanks, everyone.
Bye, everyone.
Bye.
Bye, everybody. Thank you.
Thank you all. Thank you all.